And doctor, what do you mean when you use the word pandemic? Welcome.
Hi, it's nice to join you. And I do think that we are heading towards a pandemic, which means that it's a sustained community transmission that's not just with people who have been to the epicenter, to Wuhan, China, but it's person to person in the community. This is what we're seeing now. Now we have over 30 countries where there is this novel coronavirus, and many of these cases are not related to travel. We are now also seeing countries that don't have well-developed healthcare systems. And I am very worried about what happens when this outbreak hits those countries. It's very likely, too, that the numbers that are being reported are an underestimate, that there are a lot more people who have mild or no symptoms, who are not being counted, who are not being tested, who may actually have coronavirus and be spreading it to others.
Yeah, and you get that, Dr. Wen, because there's a couple hundred people in Italy that ostensibly have the disease. Italy, of course, has a population of 60 million. So China is more than, what, 20, 25 times larger than Italy. Do you think that China is purposely underreporting its numbers, or do you think they genuinely do not know?
There are many reports of hospitals running out of testing kits, and it seems that there just isn't information about how many people who could be out there, who could be infecting other people, and just don't know it. And I think Italy certainly gives me concern, too, that these are the cases that we know of, but how many people are not yet being tested who have the disease?
You know, one thing, doctor, if it's true that the number of cases ultimately underreported, but the fatality rate stays the same, then in a way you could say that's encouraging. Do you expect both of those to increase, both the number of people who have it and the fatality rate? And is it maybe helpful that at least some of the Western countries could give us more transparent information?
Well, right now, the fatality rate for this novel coronavirus looks like it's about 2%, which is significantly lower than SARS at 10%, although it is higher than influenza, which is 0.1%. So it is possible that over time we might find out that there are many more mild cases, and then that denominator is going to be increased. To your point, though, I think transparency is so critical. Public health depends on public trust. And the U.S. government has been very good about being transparent about their responses. A changing response actually is a good thing, as long as someone explains why that change is happening. It just means that you're being nimble and agile and responding to the most recent information, which is what the U.S. government is doing. I am very concerned about China and some of these other countries where coronavirus is now spreading to. If they have unstable government institutions, if the public already doesn't have trust in the government, that could make the outbreak much more difficult to contain. And diseases know no boundaries, so we're only as strong as the weakest country in the world.
What's our status, doctor, here in the United States? I flew this week and the plane was packed. You live in Baltimore. Would you get on the Acela? Would you get on a flight of BWI right now?
Well, I am 8 months pregnant, and so I myself might not be getting on too many modes of transportation.
Into it, yes. But how about for those who may not be pregnant?
The most important thing is that this is a very quickly evolving situation. The risk to the everyday American right now is very low, but that may change at any given moment. And so watch the Centers for Disease Control and Prevention website. If you're planning any travel, heed the guidance from public health officials. Don't go to areas that currently are under travel restrictions. And remember, too, that influenza and colds and other diseases are spread the same way as coronaviruses. And so wash your hands carefully. Don't go around other people who are sick. Stay at home if you are ill yourself. And these are all good things that you can do to prevent yourself and your loved ones from getting sick.
You know, doctor, real quickly, that just reminds me, we've had, flu and colds and this and that go through our house. And my efforts to bleach and quarantine did nothing to stop it. So listen, what would your best advice be for, is it just immunocompromised people who should basically self-quarantine then? And when and for how long a period are we talking? Because it's really hard to stop these things from infecting you once they're out there.
And that's why the best thing that we can do is to wash our hands a lot. I know that sounds very simple and very basic, but at the same time, while we're waiting for treatments to be developed and vaccines to be developed, which could take months or more than a year, the best thing we can do is just watch our personal hygiene and watch the travel advice and other guidance, because this will be moving very quickly.
口罩从进料然后到出来就是一体成型，而且我们的口罩是全封闭的，并没有接触任何的这个外界。
Breaking overnight, U.S. stocks look set for a sharply lower open amid growing fears over the coronavirus. And in South Korea, a frequent visitor to a U.S. military base has tested positive for the disease. South Korea is one of multiple countries where coronavirus infections have skyrocketed. Remy Inocencio visited that military base in Daegu near the epicenter of the South Korean outbreak.
Here in South Korea's city of Daegu, the country's fourth biggest, coronavirus cases have quadrupled since Friday. Empty streets have become the new normal for this city of 2.5 million residents. Daegu is also home to more than 2,500 U.S. military servicemen and women. CBS News was granted access to the U.S. Army garrison here, with temperature screenings and the same questions for all visitors.
Can I take everybody's temperature? Yeah.
And today, a first for the U.S. military in Korea. A 61-year-old woman linked to an American soldier at this base has now tested positive for coronavirus. Colonel Edward Blanco is the face of the base, giving health and personnel updates on Facebook Live.
On a personal level, how are you feeling with the situation outside?
I'm nervous, but I feel confident, too. The coronavirus is really harsh on people who are vulnerable. Our population, relative to the regular population, is not vulnerable. Still, though, we're all nervous about it.
Meanwhile, in the U.S., people are protesting against plans to quarantine patients in California and Alabama from the virus-stricken Diamond Princess cruise ship anchored in Yokohama, Japan. The Trump administration backed off plans for Alabama, but is confident in the country's response to a potential outbreak.
We have the greatest doctors in the world. We have it very much under control.
And here in Daegu, this city is basically under a state of emergency, but not under an official lockdown. Well, at least not yet. As for the capital, Seoul, the government is under increasing pressure. For example, the Parliament building has now been shut for its first time in history. That's after a man who is now confirmed to have the coronavirus walked through its doors last week. Tony?
Remy Inocencio in Daegu, South Korea. Remy, thank you very much.
MedCram.com. Welcome to another MedCram lecture. We're talking about SARS-2-CoV or COVID-19. This update is for February 24, 2020. A lot has happened over the weekend, and we've got a lot of stuff to talk about, not the least of which is Italy and South Korea. But before I get to that, I just wanted to go over where I think MedCram fits into this whole thing, because there's a lot of news sources out there. You can read a lot of things on the internet about a lot of aspects of the coronavirus. And what I think the niche that MedCram serves, and will continue to do this, is to take the medical aspect of this and try to explain it as best as we can, because I think that's our wheelhouse. Where did this coronavirus come from? What are the true numbers? What are the political, ideological aspects of it? We try to stay away from that, kind of stick to the medical information that's coming out and try to explain it to you as best as possible. So with that being said, here's the map from the Johns Hopkins site. We can see here that the total confirmed cases are increasing, although not as fast as they were. Total deaths are also increasing, but not as fast as they were. Total recovered seem also to be kind of leveling off. There is a site here in the link where it says Lancet article, and I want to go to that to show you what they are doing over there at the Lancet. They have a number of articles. They also have their own graphs where they compare the WHO, the Chinese CDC, and the Johns Hopkins University site. But one of the things I want you to look at is this related hub, and that is the COVID-19 Resource Center. That's at the bottom. This is where you can get updates on interesting articles that are published across the Lancet platform. The Lancet, of course, being a very reputable medical journal. The other place that I wanted you to look was this site from Nucleus Wealth. They have a lot of different graphs on this site, and we'll leave a link in the description below. They've got, for instance, some graphs that I haven't seen before, where it shows here the change in cases based on the season. So the winter countries obviously are having an increase, whereas the summer countries are not. Of course, there may be some confounders here because a lot of the countries that are having an increase happen to be next to China. And of course, they're in the northern hemisphere, and so they're currently in winter. But you can see here a number of the different graphs. We've got the doubling time, which I had not seen before. And then one of the graphs that I thought was really interesting was total deaths, of course. But then this issue that's been brought up all throughout the last month or so, which is the mortality rate using lag periods. And so what they did on this graph is that if you were to delay 4 days, what does the mortality look like it is doing in the rest of China? A delay of 8 days, a delay of 12 days. You can see they're all kind of leveling out here as time goes along, just below 1% for the mortality or the case fatality rate. However, in Hubei province, doing the same kind of analysis, you can see that we're coming up with a different mortality rate if you look at these numbers based on this. If you looked at world excluding China and Iran, the mortality rate using different lag periods, you can see we're back to around 2 to 3%. And of course, there's more analysis. And just like any good site, they give their data sources. So I thought this was a good site to add to your armamentarium for those of you who are liking to look at the COVID-19 statistics. Of course, our favorite one that we always go to is the Worldometer, which gives us the updated coronavirus cases, deaths, and recovered, our active cases, closed cases. Another reason why I like to use this site is because if you scroll down below all of the country-specific data, you will see an update, and this is very helpful. So let's go through this. Of course, the Italy outbreak being the biggest over the weekend. There's 78 new cases as of today and 1 new death in Italy. This was a woman being treated for cancer. There's 4 new cases near Bergamo, 2 new cases in Venice, and a 70-year-old male in Valtellina, and a couple in Turin who visited their child at the Regina Margherita Hospital yesterday. Those are all new cases. We've got 114 cases in Lombardy, 25 cases in Veneto, and you can see the other ones trailing up. At least 26 patients are in critical condition in the intensive care unit. And if you look at that number 26, and divide it by the number of cases that are there, which is quite substantial, it is coming out to a little bit more than we would expect to see in the intensive care unit. We have 11 towns, 50,000 people placed in lockdown, and we have the armed forces and the police forces that have been mobilized to form an insurmountable health belt, as they call it. And they're going to be sentencing people if they break that roadblock to up to 3 months in prison. So they're very serious. One of the things that's been interesting to see is how different countries deal with this issue. And some of the quotes as well. There is a Walter Ricciardi of the WHO adding that within 2 weeks we will know if we are facing an epidemic and that we should avoid crowded places over the next 2 weeks. So what they have done is their movie theaters are closed. More than 40 football matches have been postponed. There are games, there are fashion shows, all of which have been canceled. If we look down here to South Korea, and this is as of February 23rd, 166 new cases, 4 new deaths in South Korea, and they have risen the alert level to maximum. And you can see what the cases have done in the total cases from 31 to 58 now up to 602, and the numbers are still rolling in at this point. Wanted to talk to you about this JAMA article that was published on the 21st of February. Now, the issue has been containing this virus, and one of the ways to contain the virus is to be able to screen for it using symptoms. This is a disconcerting article showing a presumed asymptomatic carrier transmission of COVID-19, which is the disease caused by the SARS-CoV virus. What they did is they looked at a familial cluster of about 5 patients with fever and respiratory symptoms who were admitted to the Fifth People's Hospital of Anyang, China, and 1 asymptomatic family member. Then here's the key. And it showed that this asymptomatic carrier, a 20-year-old woman, was living with and had close proximity to 5 relatives. And they visited another hospitalized relative, and you can see this in the figure. There was no report of COVID-19 at the hospital. This number 1 patient was isolated and observed, And as of February 11th, she had no elevated temperature, no self-reported fever, no GI symptoms or respiratory symptoms, including cough or sore throat. And yet, on January 26th, she was positive on testing for real-time polymerase chain reaction, or RT-PCR. She then once again tested negative thereafter. Despite this, patients 2 through 6 developed COVID-19, the disease. 4 were women in ages from 42 to 57, and none of the patients had visited Wuhan. In other words, they believed that they got it through her. They did develop fever and respiratory symptoms between January 23rd and January 26th. They were admitted to the hospital on the same day. All of them had RT-PCR tests for COVID-19 within 1 day. When they looked at these patients symptomatically, they had ground glass opacities, which is the finding on chest CT, and they all had reduced lymphocyte counts, which is compatible with COVID-19. So their analysis says that on the previous study reported an asymptomatic 10-year-old boy with COVID-19 infection, but he had abnormalities on his chest CT. If the findings in this report of presumed transmission by an asymptomatic carrier are replicated, the prevention of COVID-19 infection would prove challenging. The mechanism by which asymptomatic carriers could acquire and transmit the coronavirus that causes COVID-19 requires further study. So it's looking as though it's going to be difficult, just based on fever, symptoms, and self-quarantining, to be able to prevent this from spreading based on this article. Now, we don't know exactly how often asymptomatic people are carrying this virus and able to spread it, but we do know that it is possible based on this article at least. One of the things that we're going to be talking about coming up in future updates, as we mentioned before, is we're going to talk about the molecular biology of this new SARS-2 virus. I haven't seen much out there in terms of describing what actually happens. I'm used to having these videos made for people in the medical field, people who have an understanding of biology, people who understand what DNA is and RNA and polypeptides and things of that nature. But I realize that we have probably a lot of people out there that don't really understand the molecular biology of the cell and what DNA polymerase is and RNA polymerase and what transfer RNA is and what's the difference between translation and codons and transcription. So I'm going to put a link in the description below of a nice YouTube video that describes a little bit about that. Of course, I'm not going to be leaving you out in the cold, so I will do a little bit of description and I will upload a video on a primer for understanding the terminology that we're going to use, because what I'd like to do is go through and really step-by-step show you what happens when the SARS-2 virus infects one of your cells and exactly how does that work and how is that different from the other viruses that we're used to, including HIV. So we will be helping you out with that understanding. Thank you for joining us.